Okay, now we will begin fulguration, and I will mark the borders now. Here is the leukoplakia, and it's very close to right ureteric orifice, so I will mark the border here. And these are patchy tissues, these are healthy tissues, so trigone, all the trigone. When I look at trigone, this area I had biopsy, so I will let me focus better. This is the border. I'm looking for other ureteric orifice. This one is a little far. These are healthy. This is patchy. Here, so border must be here. Put it up, Professor. These are abnormal, unhealthy tissues. This is healthy. Still unhealthy. This is healthy. Bitmesinden arkada göremiyorum. We don't have forget this little plate here. Okay, look at these patchy areas, all abnormal. So we are beginning. These are healthy. This part, right part, is more healthy. The borders here. Okay, when I look the borders, let me focus. Over there, right ureteric orifice, and this is bladder neck. And this is all trigone area, which is a little bigger in this lady. It's a large area of trigone. Here my biopsy area. I don't usually biopsy because it makes the tissue healing a little longer. So I just want to get rid of these tissues just by fulgurating them. And you see, I know they are very thin. Some people say fulguration makes a hole in the bladder, a fistula in the bladder. It is impossible. This is only 1 millimeter layer. Look at these tissues. I can scratch them like this. Sometimes in some people it's possible to clean like this. And in this lady it seems possible, which is a little good chance because when I not need to fulgurate, she will heal better. So these are all dirty tissues. Embedded bacteria are inside this. I will make a superficial fulguration, but as you see, I can scratch them. This is healthy tissue underneath. And these are abnormal tissues. I am getting rid of them. It's not possible to clean like this in every patient. Sometimes they are so sticked and you have to burn them, fulgurate them. But sometimes we can clean the tissues like this. Look, this part is clean, this part is ill. I try to scratch. Let us see. I don't think it is enough. Here it is good, easily scratched. Yes. This is nice because the healing is better in such cases, in my opinion. We will see. Look at the tissues. These are abnormal tissues. So, if somebody is healing with using antibiotics, long term, short term, any kind of antibiotics, I will not do this procedure. This procedure is only done for those who are not responding to antibiotics. Even I can, with very high percentage, say that this is enough for this lady coming from Germany. I will not leave her without fulguration. I don't want to be surprised if I would see her relapsing or being unsuccessful after the procedure and thinking that I didn't make the fulguration. So this is ureteric orifice. We had to stop here, and I am sure also in the healthy parts, the bladder mucosa may be fragile because of long-term inflammation. So I know where to stop. I marked them previously. So I'm scratching all the mucosa till the borders I marked before. So here, this is ureteric, and look at the urine coming from kidney. They are all inflamed. The tissues are inflamed because of this chronic infection. Again, I will make a superficial fulguration for her. I don't want to leave alone like this because maybe just scratching the tissue will not be enough. Because I know fulguration kills the bacteria better, and here you will see there are little bleedings. Fulguration stops these bleedings. Look, all the scratch part is here, tiny bleedings happening now. So I have to fulgurate them and stop the bleeding and kill the residual bacteria underneath. So here we have also some residual tissues. How clean underneath? Do you see the healthy tissue that she is waiting for 30 years? Yeah, I am very happy she will be healed completely. Look, unhealthy part, when I scratch, very large area, really more than usual people, because she is having the issue for 30 years from his childhood age. So I begin fulguration now, just to stop bleeding, and if we have any residual bacteria, to get rid of these. This is ureteric orifice, left orifice. I will fulgurate very superficially, not too deep in this case, because I was able to scratch. And here is the biopsy part, a little deeper tissue destruction here, but I need these biopsies for her. I don't do biopsy for everyone, because it always comes squamous metaplasia. But in this lady, because there is too long history, 30 years, and at first, initially they seemed a little bit more papillary. So I'm not suspicious about abnormal, malignant or cancerous tissue, but I have to be safe. So I will ask the pathologist to look for them. I am far away from ureteric orifice, making my fulguration. Just scratching, make the bladder in this lady. It doesn't happen for all of the ladies, but in this lady, only scratching take out the tissue. It is a good thing. These patients heal faster. but I can't leave. Look here, the scratch parts are bleeding, and there are little patchy tissues underneath. So I will not leave these with like that. I will fulgurate. And look at the fulgurated part. This is not fulgurated yet. This is fulgurated. Fulguration is not a very harmful, invasive, dangerous event. No, it's very superficial. I always say in bladder cancer cases we do very deep fulgurations, very deep resections, and we never have problem in healing of these tissues. We have to go inside and relook after 6 weeks if there is any cancer tissue remaining, and we always see after cancer cases, after 6 weeks, everything is healed completely. So we are sure fulguration is not harmful. It's not a very invasive procedure. No. In cancer, we do far more deeper resections than this one. This is very superficial. Here in the right side, we came more closer to right ureteric orifice, so we have to take care of it and make our fulguration and tissue scratch accordingly. So I'm happy this lady we are in communication with her for maybe more than 2 months. She was brave enough to come as a frontier, because it's not easy to make a decision to come to a foreign country for this. But we have all of us have to thank to Marnie Simpson, and Jessica Saunders and Ella Harris. They are the frontiers. Really, they helped a lot. And Marnie announced this procedure to cystitis communities, and everybody is aware of the procedure now. So we owe her a special thanks. Really, everybody has been aware of the procedure by her efforts. So we are very close to ureteric orifice, but still they have some bleeding. I have to stop these bleedings. But the rest of the bladder is healthy. This is ureteric orifice, and these are healthy tissue, no problem over there. So it's nearly finished. I will look for some details and show you the last video at the end of the procedure soon. So I emptied the bladder and will wash it again, and there are some bleedings. These are inflamed bladder tissues. There is nothing but only because of inflammation there are petechial bleedings. Sometimes it is misdiagnosed as interstitial cystitis, and some debris is coming from kidneys. But our main source of infection, this trigone part, is healed now. Her bladder is really inflamed. She will have some bleeding issues. In the recovery, we will give some special drug to stop bleeding, transamine, but eventually she will heal definitely at last. So here, okay, this is good enough. These tissues, inflamed bladder, I cannot touch these tissues. There are sometimes inflamed bladder tissue maybe over here. Yes, we see some petechial bleedings, always in the lateral walls of the bladder. And now it's okay. It's good enough. I hope she will feel better. She will be completely healed.